Voice feminization surgery was created to increase the pitch of the voice to make a voice more feminine. Obviously, this surgery it's mainly performed in transgender women, but it's also suitable for women who want to have a higher pitch voice. The objective of this surgery is to create either smaller, shorter, or thinner vocal folds. In that way, we'll make a fastest vibration of the vocal folds, and that will increase the pitch of the voice. There are different techniques to have a voice feminization surgery. Most of them, and the most used ones, are performed through the mouth of the patient. This means that this is a scarless surgery. Other important thing is that the patient it's going to be discharged the same day of the surgery. It's not a painful surgery, and the results are very good once the healing process finishes. Very important about the surgery is that many times it's combined or it's performed at the same time of other affirming identity surgeries like the resection of the Adam's apple or the chondrolaryngoplasty or the tracheal shave. I'm going to explain a little bit the different techniques that we can do when doing a voice feminization surgery. Wendler's glottoplasty, it's a surgery that is done through the mouth, and what it's looking is that it's trying to create a web or a scar between the vocal folds. It's the surgery that is most commonly performed all around the world to create a more feminine voice. The second technique, it's called LAVA, which means laser assisted voice adjustment. This is a surgical technique in the one we use a special laser, a CO2 laser or a blue laser, to make superficial evaporation of the superior parts of the vocal folds. And this has shown that also increases the pitch, fundamental frequency of the voice of the patient. One important thing to discuss here is that we can perform at the same time LAVA and the Wendler's glottoplasty. And actually performing these two at the same time has shown in different studies that increases the voice pitch, increases the fundamental frequency, and increases the satisfaction of the patients after receiving the two procedures at the same time. So it's very important to know if available or if possible, doing these two surgeries at the same time increases the chances of getting the desired results of the patient. The third technique, it's called vocal fold muscle reduction. And this technique is used most commonly to treat those patients that didn't get a good result after either of the two previous surgeries or who are willing to have a higher pitched voice. So although it's not common to perform this as a unique procedure or as the first surgery to have in terms of voice feminization surgery, it's a surgery that can help to get better results if none of the previous ones have shown a good result. Again, all these surgeries could be performed at the same time with the Apples-Adam reduction surgery. These surgeries needs to be done under general anesthesia, and one of the important things to remember about the surgeries is that we ask patients to be quiet after surgery for around 10 days because we don't want the stitches and the surgery to get damaged because of vocal fold use. Here at Centro Eleva, what we do is before surgery, we do a complete voice evaluation of the patient. We see and assess the vocal folds and how they vibrate, and after that we do a complete assessment of their quality of their voice. We record the voice and we develop a post-surgical plan to get the most out of the surgery. Then after 10 to 15 days after surgery, you will start to have a one-on-one session of voice therapy, and slowly you will begin to discover that new voice together with one of our speech language therapists.